Good day and welcome to the 8th Crikvenica International Health Tourism Conference, the most prominent regional health tourism business-to-business event, and for the first time, a global virtual conference dedicated to health tourism. So we will start with the first part of the conference and with the very content that you are mostly the most interested in, and that is the impact of the pandemic on health tourism. We have all been impacted in different ways, in many ways, all of us individually and socially, but let's listen to what the experts have to say about it. So the first speaker in the conference and the opening presentation will be held by the professor at Goethe University Frankfurt and director of Institute of Biochemistry there, Mr. Ivan Đikić, about therapeutic approaches against COVID-19.
Thank you very much. This is a great pleasure for me to be part of this International Health Tourism Conference. I'm very pleased to share with you our ongoing interest in understanding pandemic of COVID-19. And this pandemic has affected both our health and the tourism. And I hope we will learn both from both sides. And I'll be very pleased to discuss with you in the second part on ongoing efforts, what is predicted in 2021 and 2022. But for now on, I would like to focus on research on the topics of how do we treat and how do we win against the COVID, and what are our major advantages based on knowledge, and how do we, with the knowledge, can actually create very efficient therapeutic agents that will prevent spread of the virus. Here is just a brief introduction of our enemy. This is a virus, a small virus, which is a type of a corona because it has these spikes on its surface. It is RNA based, and RNA is a major genomic material of this virus, which is covered by proteins. And these proteins are really tightly covering the genomic material. These are nucleocapsid proteins. And they are helping the genomic material not only to be secluded, but also to be properly structured. And once the virus enters to our cells, genomic material goes in, utilizes our own ribosomes to produce a new viral proteins to reassemble again the virus, close them, and then from one, there are hundreds or thousands of viruses produced in a human cell that will come out. On the surface of those viruses, particles, there are several proteins. One of them is a spike protein. We will come back to it. It's very important because this protein is an entry key of a virus to enter to our cells. And very importantly, this protein is also one which we are creating all of the vaccines at the moment. So let me just briefly summarize why this virus is so dangerous. First of all, it is because it is a quiet, fast spreader, and it creates a lot of symptoms that we do not recognize immediately as a viral infection, but it may affect the risk population, and that has caused, at the present, 53 million people have been infected since December last year, 1.3 million global deaths across the globe. It has a tissue tropism for the respiratory tract, but it has also many, many other symptoms, many other organs which have been affected. Therefore, we talk also about systemic COVID disease, which several aspects of a chronic consequences which are still not completely understood, but we know that it's so-called long COVID. In a percentage of patients, there are symptoms that persist long after 24, 28 days, which is a normal respiratory cycle. And these consequences we really need to study because they might leave to us sequels of chronicity in which we might only recognize in a few years' time, and the more data will be present. And secondly, we have also learned by very rapid accumulation of knowledge that without drugs and without vaccines, there is only epidemiological proper measures that help us to control the spread of this virus. Virus has spread from China through Europe, US, around the globe. what has happened in spring is that few countries which were ready, and that's particularly the Asian countries which had quite a lot of experience with the swine flu, with the bird flu, with SARS and MERS in the past, they were ready to react. They were ready to react with the rapid measures. And first of all is a success of so-called South Korea story. It's called T3, which stands for test, treat, and track, meaning they have developed as soon as possible a very sensitive genetic test, which were used at a very high level. They have reorganized their entire biotech technologies, universities, to be available and to be incorporating all these new technologies for testing. The treating means that they were trying to develop any of the repurposing drugs such that they would get any benefit, particularly for the risk groups and very late stage difficult cases of a disease. And the track means that anyone who was infected was very carefully epidemiologically treated, meaning secluded, but also tracked all the people who were in contact with that person. In that case, they were actually trying to limit the spread of the virus, particularly because this virus was spreading fast and asymptomatic. Therefore, even though it started with very large numbers, very rapidly by using these measures, South Korea has managed in the spring to be one of the countries with the most successful story, the least number of lost lives. And that has persisted up to now. Even in the second wave, they have done very well. In addition to South Korea, Vietnam, China have really remarkable stories. In both cases, the spring and the fall wave, these type of epidemiological measures were the key to their success. Around the globe, we have also learned that in Europe and the US, we can expand it and we can actually make it a little bit more incorporated to our societies, where there was not so much of the governmental decisions, but we were hoping that by education of individuals, of our societies and our businesses, we are going to make the similar success. And indeed, in Europe, we have been very successful in spring. The fall is now hitting us again, but we are facing the similar challenge. We need to mobilize the people. Everyone should participate. We need to control the sources. We need to find and isolate and treat all the cases. We need to suppress the transmission of the virus by preventing measures. And first of all is keeping the distance, keeping the hygiene, wearing the mask when appropriate, and trying to be responsible and trying to help those which are in the risk groups. And in that case, we will reduce the mortality, particularly in hospitals and those which are aged and chronic diseased people. And we are hoping, the best hope is to develop safe and effective vaccines or as alternative therapeutics. And this is going to be the talk which I would like to focus today. And in this way, we're going to eventually help to reduce mortality rate, slow transmission, and with vaccine, the realistic hope is that we are going to build up sufficient collective immunity to be able to win over this pandemic, and hopefully in 2021 be free, in 2022 be completely back to normal life. So I mentioned to you the spike proteins. These are the proteins which are on the surface of the virus, and that's why they create these crown type structures by EM. They are very dynamic. You can see that they are moving constantly and they almost explore. They're going on the surface of our cells, finding the receptors, engaging with them, entering in our cells. And they're also glycosylated. All of this green is glycosylation on the proteins. And that is important because our antibodies and our vaccines are created against the proteins. So the glycosylation might have an impact on that. That's still an open issue. So I mentioned the vaccines. So these are the 4 types of vaccines that have been created within a record short time. Since January until today, more than 100 plus vaccines have been created. They belong to 4 groups. Genetic vaccines, which are built up on messenger RNA encoding the genes, using adenovirus viral vectors, in which they also put the genes of COV2 in the viruses. And there are protein-based vaccines in which you just purify the protein of the coronavirus, COVID virus, put it to the patient. build up the immune response, and the attenuated whole virus vaccines, which are minority of the cases. The most vaccines today are based on the adenoviral vectors and on the messenger RNA encoding for the COVID viruses. And these are the companies which are developing. I'll give you just a summary, theoretical summary of these two. Few of them have been already limited approved, 2 in China and 1 in Russia. That only means that they are in the phases of clinical trial, not yet fully approved. This is so-called pre-approval and the stage 2, just for you to know that in the media this happens, but these are not yet fully approved and not usable vaccines. So I mentioned to you there are 2 vaccines, adenovirus-based and the messenger RNA. Adenovirus is the one which is pioneered by Oxford and by AstraZeneca. In this case, you have chimpanzee adenovirus, which is modified such that we remove the pathogenic genes from inside. And therefore, we have an empty skeleton of the virus, which is not pathogenic anymore. This virus has been already used for Ebola and other vaccines in the past. And therefore, they were very fast in acquiring as well, putting inside this empty virus, putting the sequence of a gene of the spike protein to the genome of the virus. And then this virus now becomes a carrier of a protein of the coronavirus, and that can be then injected in a patient, and patient is going to create both humoral and T-cell dependent immunity. And that is what we are going to measure and try to see, can we create now immunity in the people and prevent the spread of the virus. So the base here is antigen from coronavirus, put in adenoviral from chimpanzee and create vaccine. Alternative is messenger RNA based. Here you don't need to have anything else. Here what you use a lipid mixing with a messenger RNA that encodes the same protein, spike protein from coronavirus 2. You mix them together in a specialized protected BioNTech. It's a German company, small biotech company, which has this patent on how to use the messenger RNA to build up an antigen within the lipids, give it to the patient, and create eventually a response that can provide both antibody and the T-cell dependent immunity. And this is what we are hearing this in news, that BioNTech and Pfizer have come out all the way to the clinical trial 3, having more than 44,000 people with very strong response, more than 90% positive response, which gives a great hope for having a vaccine early next year to public. And this is where we stand at the moment. There are 11 vaccines in the clinical phase 3, and clinical phase 3 is 20, 30, 40,000 people being in placebo and provided with vaccine. It all needs to be blind. It all needs to wait until the end to validate 2 things. One is efficiency, the durability, type of immunity, and fourthly, presence or absence of any kind of other symptoms, nuisance effects, which might be tolerable or not tolerable. Only after that, the regulatory bodies in Europe, US, India, and other countries will give a final approval, and only then the vaccine will be accessible for people. And priority will be always given to the risk groups, the health professionals, and then to the public. And we need to be aware that even though when the regulatory body approves the vaccine, there is a time for production, distribution, storage, and creating all the vaccination places. And these are the millions of the people around the world who would like to be vaccinated. And the hope is that vaccines will be on time, available, and free for anyone who would like to protect themselves and their families. There will be no forceful vaccination at the moment planned. So this is the summary. Approved vaccines early 2021, production, distribution, and broad use vaccination throughout the 2021, and then protection by collective immunity second half to the end of 2021. And the hope is that 2022 we are entering with the full control, or larger, almost full control of this pandemic. And this will help us then to focus on health, focus on tourism, focus on our life. I think that's important. Education, kids, families, all of this is a big hope to be back to us. So alternative to vaccines, I think we have great hopes with vaccines, but alternative to this are drugs. And today there are two approaches by taking therapeutics. One is that you work on the symptoms in a patient, like dexamethasone, which is showing very good signs of reducing immune-dependent chronic responses. And secondly, targeting virus itself by utilizing weak spots, Achilles tendons of the virus, for example, viral enzymes, which we can create as specific drugs. And here you see what has been tried up to now. You have heard quite a lot in the media about chloroquine. Trump has been using it, even though initially on the 12 patients there was success, but later on there was no success. Remdesivir is yet another compound which is built up as a nucleotide inhibitor of the viruses. It shows much stronger success. Favipiravir is also nucleotide analog that inhibits viral replication, developed for influenza, shows reasonable success with the blocking COVID as well. But these are only in a subfraction of the patients. So there is a lot to be discovered. One of those which are being developed, and I'll cover to you few, are the antibodies. This is also which President Trump was receiving from Regeneron. You can create antibodies which are twofold. On one side, you can take them from patients which have developed antibodies against the virus. You can take this reconvalescence plasma, isolate from them antibodies, give them to the new patient, and this new patient is going to attack the virus and block the virus, these spike proteins, such that they are not going to be able to explore our cells, not enter to the cells, and that way we are going to prevent and block viral spread. Not only you can do that from plasma, but you can also do synthetic antibodies now, and with the synthetic antibodies, you can successfully, still in the clinical trial, successfully prevent the viral spread. And then there are viral enzymes. So these are proteases. And this I will talk today to you about. These are the proteases which are being blocked by the different inhibitors which are produced for HIV viruses like ritonavir. And they have shown also cross-reactivity with the proteases of COVID viruses. And today this will be a story which I would like to share with you. How can we now not only use those from HIV, but create a completely new specific inhibitors for this type of enzymes? And this comes out to our current discoveries in which we were trying to understand how the life cycle of coronavirus can be prevented. We know that virus enters via these S proteins, enters to the cell, releases this RNA, which is genetic material. Genetic material produces all the proteins which are needed to create the new viruses, and then the new viruses can spread out and infect thousands of other cells. Two types of enzymes are important. A proteases which cleave these proteins, and replicases which replicate messenger RNA to the needed component of the virus. And story is about the two fantastic postdocs in the lab who have taken amazing work from early March until today. During the corona time, they worked on a topic: how can we identify COV2 enzymes which are essential for viral spread and immunity? And how can we do that in a very rapid time and be meaningful to bring certain knowledge to the community? So in the corona time, we had the focus. We didn't want to panic. We ate well. This was a large part of my own work. I was bringing sarma from Croatia, Japanese sushi, just to be as a group, to get the support. We helped each other, we slept enough, shared knowledge, and collaborate with anyone around the globe. And that was a part of our success. And success came out because we focused on these proteases, papain-like PL protease, which is essential for cleavage of the viral proteins to assemble the replicase. And if you block this protease, what happens is that virus cannot spread anymore. So we wanted to understand how this protease works. So Don Hugh has purified the protease in a record short time, from March 10 to March 31st. He has gotten purified proteins, put 20,000 conditions to get crystals, and he got crystals of these proteins. These crystals are important because they allow you now to identify atomic details of the entire structure of this enzyme of the coronavirus. And in 10 next day, so on the April 10th, he solved the entire structure of the viral enzyme in a complex with a human protein called ICG15 as a substrate. This protease cleave this ICG15 away from other proteins, and in that way, block antiviral response on our side. So that was quite remarkable. This protease does not only cleave its own polypeptides of the virus, but also cleaves the human proteins which are involved in antiviral response. That helps us tremendously to also identify an inhibitor which fit in the middle of the cleavage side of this protease and block the human protein to be there. And in that case, block the viral protease. Surprisingly, we recognize that this inhibitor, which we found, it worked for SARS, worked for COVID, but it didn't work for MERS. So there was something unique. Based on a structural work, we identified the uniqueness in this amino acid tyrosine, which was present both in SARS and COVID, but was not present in MERS. And this is evolutionary play. By mutating this tyrosine to threonine, you can see that COVID enzyme is also not now inhibited by the drug. So the drug truly required the tyrosine to be located and to be acting. By using this inhibitor, we were able now to ask the question, how do we infect these cells? Can we prevent the viral spread? So here is the primary viral isolase that we got on January 2nd in the tourists coming from Wuhan to Germany in Frankfurt. 2 of them were asymptomatic, but a very talented physician has identified, taken the viruses from them by taking the spread, put it in a tissue culture, and grew a lot of viruses. All these viruses we are now using as a primary isolate. So you can put them on non-infected, infected cells, and you will see that the virus kills the cell within the 2 to 3 days. Now on the top, if you put this inhibitor, which we identified, now you rescue the lethality and the cells survive again. And you can also look not only of the survival cells, but you can also look active viral replication. You can see that whenever you put more and more concentration of the inhibitor, you are killing the viral replication. You can acknowledge here that this is a logarithmic scale. So it's almost complete block. And in the same time, you are blocking the release of the virus in the media, so virus doesn't spread. So that was important. But the other important stuff is that in the same time, we have also observed that by treating virus with the inhibitor, we have been increasing antiviral response, not only blocking virus, but we also increase this interferon-dependent antiviral response. So that made us to conclude that this protease of the virus is essential, because without that, there is no viral replication and spread. But in the same time, this protease blocks our internal antiviral response by blocking ICG15 and interferon pathway. So now, by identifying an inhibitor of this protease, on one side we block virus, and on the other side we increase antiviral response. So this is a double hit therapeutic strategy by shutting down virus and promoting innate immunity. And I think that brings us very, very high promises for the future. It suffices to say that now from this discovery to develop a drug will take time. And this is normal. Like in any other discovery, it takes few years to 10 years. We're working very hard. Now it's a time to bring together pharma industry, foundations, academic institutions to work together and to try to speed it up to the highest possible level. And we are hoping that within a year, 2 or 3, we will have something that is a real drug and that can be used to prevent, if not COVID, but then coronavirus 3 or 4 in the future. And the hope is that these inhibitors only of the proteases might not be working alone the best. They are potentially best when they are combined with replicase inhibitors, the second enzyme. This we already tested by the combination of remdesivir that block replicase and cimeprevir, which blocks protease. But this is against the hepatitis C, and this is against Ebola. So even though they are not perfect, they work, because When you put them, you see that there is an inhibition here as well. And you can see in concentration-dependent manner, only when you have a high concentration, you shut the viral spread. Same here, remdesivir. But when you start combining them in a very low dose, look at this, already 50%. In this, 90% inhibition, even though the doses are very low. So that tells us in the future, we are looking forward to find the specific drugs now against the protease of the virus, a replicase of the coronavirus, and then make combinatorial targeting of both of them, and then use them successfully, like the people have developed therapy against AIDS and hepatitis C by blocking their own enzymes. So that's a big hope that in the future for coronaviruses, we're going to be as successful. And in parallel, a lot of physicians are using repurposing drugs to go after anti-patient symptoms. I mentioned to you the dexamethasone for suppression of inflammation, cytokine storm. There's also bradykinin inhibitors, antihistaminic, and the list is growing. But those are mostly for hospital and mostly for very late stage patients. So I would like to stop here by just acknowledging amazing team of scientists. I mentioned to you Donghyuk, Rukmini, but here is Diana as well, and Anshu. They were true COVID team in my lab, but we also had many other colleagues from virologists in Frankfurt, led by Sandra Cisek, and also colleagues there. And this has been a true, but really true collaborative effort from many people by sharing reagents, because within 3 months, we have accomplished all of this. Within 3 months, we have reported it just 2 months ago, and this manuscript has really attracted a lot of attention, and we continue working together and spreading it further and incorporating more of the pharma companies. And just to see once again the people, here is also the food, and here is a discussion, and here are the colleagues from the virology of Sandra Cisek's lab. And at the end, I would just like to send you the greetings from the lab in Frankfurt. This is the current online science with progress reports. That's how we discuss science, but we are determined to help on the COVID side, but also help on other projects. Now we are back to the business, and we are looking forward to the new successes in science. Thank you very much for your attention, and I will be very happy to answer all the questions in the later stage, and continue with the discussions when we are done. Thank you once again.
We thank Professor Đikić for a very informative and interesting presentation based on some scientific data and research. However, the next presentation, as fits to tourism professionals, is a bit more optimistic. So let us share with you the second presentation of the first set by Ms. Leila Krešić-Jurić, the Managing Director and co-founder at HTI Partner. And she will tell us something more about Croatian health travel and take the momentum with it. So Ms. Krešić-Jurić, if you please.
Good morning. I'm honored to take part at the 8th edition of the Crikvenica International Health Tourism Conference, which actually I remember when it started 8 years ago, practically, at the occasion of 125 years of celebrating health tourism in Crikvenica. Well, first of all, let me congratulate to the organizers for being brave and being insistent to organize this event. Both it goes to the Crikvenica Tourist Board as well as to Kvarner Health Tourism Cluster as well as other organizers. Well, we heard a lot of challenges. I'm still very much optimistic and still believe that this is the moment that Croatia can take, and then actually we can now capitalize in the years to come related to tourism and especially in health tourism. So let's see what some data that I have prepared for you for today. So first of all, we all know that 2020 started in Croatia, but also in many other countries in Europe, started as a year of glory, full of glory. We expect it to be even better than 2019. However, it happened that some external factors just prevented our development, and it is just so simple as travel restrictions, something that we can't remember that existed in our lives up till now. Of course, there were some new words that came out. Social distancing is something that's very important. We have to face even in tourism. And we are talking about a new normal, but I mean, what is exactly normal, what is new? We are already adapted to these circumstances. What is bad news is the predictions that UN, WTO, the World Tourism Organization, predicts that this year will be at least 70% of worldwide decrease of international tourism arrivals. Europe counts a bit less, but even Croatia is doing better. We expect like 50. I heard today from the Deputy Minister 55%, but still these are very bad numbers. We can call them like an empty victory in European terms. However, several global organizations are doing, actually taking some initiatives. First, the WTO, the World Travel Organizations, they are doing a lot of research and practically endorsing tourism and tourism development in these times. However, their findings are that travel restrictions and slow virus containment, as well as slow confidence of the tourists, it's slowing down. They're becoming barriers to development, but also the lack of coordination among countries about what protocols to harmonize, how to make tourism flow still coming. However, the World Travel and Tourism Council, the WTTC, launched already in May some safe travels global protocols. They have been done for hotels, for tour operators, even for insurance companies, for rental cars, many stakeholders in the tourism industry, but yet not for health travel. And we may say that we would like to hear if this could be also performed for the health travel sector. A few days ago at the World Travel Market, also the first time in the history it was organized as a virtual event, Euromonitor presented new findings. I will not read them because I guess that it's much more efficient if you can check them from the screen. But I would like to add what Euromonitor counts and what they actually say about what they foresee about Europe. So they foresee that there will be emphasis on digital green transformation and the circular economy. This is especially very strong already in the Nordics countries. And they're talking about regenerative tourism, which already has been adapted into some destinations, like in Flanders, in Amsterdam. This is nothing else but the new word for the holistic approach to communities, practically preserving the tourism destinations as the way that locals would like to live in them, not only escaping from them like it was in the case of mass tourism. On the other hand, we also have the European Travel Commission, which launched the handbook on COVID-19 recovery strategies. If you can see on the left, the travel preferences for 2020, and it's going to continue already for the next year, it's almost all about health. Just look at the words, the well-being, the air quality, environment, open space, fresh air, active holidays. That is all what matters, and I would like to emphasize it because it matters very much for Croatia. And in general, the recommendations for the National Tourist Organization goes to the direction that would like to, actually the goal is to convert Europe as the most sustainable destination in the world. European health travel is very significant in Europe, not only in terms of financial terms, but also in terms that Europeans like to travel across Europe. And even more of them are willing to travel across Europe nowadays. But what is interesting is that more than half of Europeans are willing to travel across European countries to get medical care of a better quality, which opens the space for development of health travel within the continent. Namely, at this moment, capitalizing on the European Cross-Border Healthcare Directive, which has been sometimes perceived as obstacle to travel within Europe for seeking care. Actually, 70% of patients' flow already occurs in neighboring countries, which is actually a very good message for all of us where to seek our new markets. It's usually framed but sort of bilateral schemes that avail cross-border healthcare. Very strong ones are between France and Belgium, or Luxembourg. Citizens go to Germany and Belgium, or Germany to Austria and Switzerland. And I would like to stress out a bit of good news. So Europeans want to travel. These are very recent research done a few months ago. or even super recent from a few days ago. But altogether, they point out the European travelers choose Europe as a destination. And for us, it's very important that 40% would take the car. And we know that Croatia is a destination easily reachable by car to many Europeans. The trips are motivated by family visit, health, and religion. The Europeans plan to travel within 6 months. Across Europe, for 1/3, health and safety is very important. And we can say that still, what is very important, 74% of travelers perceive that destination should have sort of health and safety certificate. So these are the new paradigms that we can say today that are prevalent in the health travel. I would add, and I actually added at the very beginning, at the top, we just, after 100 years, like it was 100 years ago, we again started to greet each other with stay healthy, not just have a nice day, but stay healthy. It's becoming very, very important. And of course, not any changes comes easy to adapt. So what's the situation in Croatia? First of all, I would like to also point out that the further slides will encompass health tourism and travel together, like a wellness and health spas and medical. So we are all talking about from well-being through medical spas to medical segment. So we take into account the secondary wellness guests, those that, for example, come to Croatia, but also for them, they're coming for holiday, but for them, wellness is super, super important on their holiday. The research of the Zagreb Tourist Institute showed that the main products that we are offering is relaxation, it's physical therapy, dental services, and rehabilitation. And also that we can say that promotion today is being carried out, namely by Croatian Tourist Board, National Tourist Board. Partner cluster is doing a great job by spreading the voice of Croatia all over the world. And also I would add a few private stakeholders like Bagatino, St. Catherine Hospital, and a few others, not to forget someone, who are also doing a lot of marketing out of the borders. But what are actually the open questions and something that we should work on? These are definitely statistics. There are no data. Even there are some, but there are not enough data that we can do proper benchmarking within ourselves as destinations, but also to the world. And we still have to work a lot on joint promotion altogether. So part of the good news are that the foundations for becoming sustainable, Croatia already has. You can see the results for Team 2022. These are all very important topics for becoming tomorrow a truly sustainable destination. So what are the effects on the Croatian economy? So I was asked by the organizer to try to figure out what would be the effects on Croatian economy. Of course, we can all talk. Yes, it reflects on employment, on infrastructure, on country branding, definitely, on travel, on retail sector, agro-food. Of course, these tourists usually seek also healthy food, technologies. It's all true, but okay, how many of them they are coming and how much money these tourists leave in the country? So I took the numbers and we at HTI developed sort of integrated indicators, a group of integrated indicators that can show you very precisely the people who are coming visiting Croatia motivated by health. So we are here talking about visitors who already came in Croatia and they stated, yes, I'm here because of some of these reasons, and one of these reasons was health. They also offered the opportunity to say, yes, I'm here for holidays, but on my holiday, my primary motive actually is wellness. That's what we call secondary wellness as well. So if we take into account all these kind of guests, including the one-day visitors and dental travelers, who usually, many of them, so we are talking about 80,000 dental visitors we estimate that are coming to Croatia per year just for dental treatments. Those that we can record. Of course, if someone is coming to visit his dentist for 10 years, probably we don't have a track about him. So in total, we can say that a bit less than a million, precisely 920,000 visitors are motivated by health, and they're already in Croatia, not in 2020, but in 2019. Their contribution to a Croatian economy has been estimated as 585 million euros. This is the wider definition. Of course, if you want to take only those visitors who travel exclusively for health, they're not talking about their holidays, or they're not having other motives, then the figures drop to 570,000 visitors and 400 million euros of turnover. So the message in general would be just to take the momentum, to listening to what the figures show and what the needs of the clients on the market show. It would be just innovate, digitalize, and embrace sustainability. So what's in it for us, actually? What are the opportunities? Here you can see all of the elements that Croatia already has, or it's about to have and to welcome. And these are the opportunities that should allow us to practically promote much strongly the health, travel, and tourism. What is interesting, the research done by the Zagreb Tourist Institute last year showed that half of the tourists coming to Croatia visited the country already 3 or more times. But those who are health tourists, actually, who are coming for health, these are those that visited 6 times or more. This is a very clear message for future marketing initiatives. So one opportunity is to offer what we already have and what we are doing, but probably we need more kind of packaging right now, offering to Europeans that they can recover their lung, they can recover their body, especially those that already survived COVID, or those that are wanting to prevent it, to come to the country and to practically, based on scientific data that are very much existent in several destinations like Croatia, like Crikvenica or Opatija, or southern part of Croatia as well, they can practically boost their organism to prevent and to become, to have better, to get better well-being. And why not offering packages and bundling with this certain of kind of healing guarantee, I would call it. Another great offer that we have to capitalize, still have to capitalize, it's going smart and digital. On the left side, you see several very well-known Croatian brands. Some are developing smart services, some are already very well-known digital startups. But in general, it's very important to stress out that Croatia already has a few unicorns. So there is a whole market for digital, to boost digital health, which should also help us to promote the country as such. At the end, why not establishing a Croatian health travel portal offering online medical second opinions 24/7? This is something that some countries, even in Europe, they're already offering. And the third moment, when we're talking about sustainability in the long run, we have to actually go into new markets. We know now that this half of the clients already coming to visit us should be our target market, because it's going to be much easier to target them than just go to look after Americans or Chinese. Find partners, strategic partners on these markets, but also we can take advantage of joining some marketing alliances. For example, in spite of so many historic thermal destinations in Croatia, there is only one, Daruvarske Toplice, who is member of the European route of historic thermal towns. And these guys are doing a great job in promoting historic thermal towns of Croatia, of Europe towards the world. And also, there is another very important moment that everybody is now discussing. It's about digital nomads. But what do you think about offering them a sort of health insurance, offering them free health services for the first 6 months? Of course, we all need to count on the state support. It could not be just an initiative like it was of the clinic in Dubrovnik, but we should also see it as a state initiative to boost these kind of potentially new clients. A few more ideas to consider. Out of all these, I would just stress out the first, the accreditations and certification on destination health and safety. We understand it's important. It's not only for Croatia and in Croatia, it's important for whole Europe, and we really need that something, the moment it's possible to acquire, that we should also acquire it as a destination, as stakeholders in the health travel. We should strategically, so this is something I would say urgent, but when we talk on the longer run, But starting from now, why not think about bilateral agreements? There are great clinics in Slovenia or in Hungary. We can offer them some kind of medical services their citizens can use in Croatia and our citizens can use in their countries, depending, of course, on this cross-border availability of health care services. And something that also, something new for Croatia, we still don't have medical hotels, we don't have really climate health resorts in the sense, in the definition, how it works out of the country. Just to mention that in Turkey, there is a strategic initiative of the government just launched a few months ago, about 10,000 hotels they are about to convert into medical hotels. This is also a very good opportunity for hotels who are now struggling with lower performance. And, but on the other hand, you have a need of the market to these kind of services. Why not have Life resorts in Croatia? 200 units and 33 million euros. It's just 500 kilometers from Zagreb, or even less from other parts, from Istria or Kvarner. This is great resort. This is just the stunning views, and this is all they capitalize, of course. If you look at their financial data, you read their sustainability report, then you really find out what an amazing business model they have developed. And that's nothing that we can't have. I read it. It's absolutely feasible even in our country. And just to conclude, it's the time for complaints. I think it's over. We had our moment, and now we have to think about the future, embrace it, and cope with the challenges. And I would like also to thank you for your attention, and stay healthy.
Thank you very much for your speech and also informative presentation, Ms. Krešić-Jurić. And now it's the moment that we all were expecting perhaps the most, especially following the latest development, the epidemic development in Croatia, as I just received the news that we have over 3,000 newly infected daily, which means the data is from today. We need some optimism, and I hope that your questions from the audience will come in that sense as well. I have prepared also questions for the people in the studio. I also have to announce that although on your screens we will in the studio look very, very close to each other, we have a studio that is entirely virtual, and although we are in the same studio, we are remote as required by the epidemiologists due to the COVID regulations. To make a question, however, you will require to use a specific technology. So we have provided for you also tutorials. To it, you will see a short video tutorial for both questions and polls and how to use the event app that is at your disposal. So let's see what actually you can do. This is the layout of the event app. This is how you make a question. You write a question. You can send it to a specific person or a not specific person. If you send it to a non-specific person, then we will try to answer the question all together in the studio, or we will target the best person to answer the question. You can send it without letting us know who you are, so it can be an anonymous question, or you can even set your name to it. So it's very easy. You can use up to 500 signs. I think that's pretty much all you could need, and these are the people you would like to set a question. So pick the panelists of this specific panel to ask a specific question, or you can just send anonymous question to everybody. We also have polls, so you can also use the polls. You will be kindly requested, especially before the break, to take your time and attention for the polls. You will be notified about the polls itself, and you please do try to use the application to fill them out. Your opinion will certainly help us into planning the future conferences and content, and we thank you for it in advance. There will be several polls, of course, throughout the day. You will receive the notification, and of course, to all of you who are listening or watching the today's conference and haven't downloaded the event app, CIHT event app, please do use your Android and iOS devices to do so and to follow the conference in an interactive, real-time dimension for real. So let us announce the panelists at this point. So we have already introduced the speakers that you are familiar with. However, we have another guest in the studio, and that is Assistant Minister in the Ministry of Tourism and Sports, Ms. Monika Udovicic. And you will all be able to see the questions provided to all of our speaker and panelists. Remind you, please do have in mind the topic, and it's the impact of the pandemic on health tourism. We will have more topics, so please try to stick to the topic that we have dedicated this first panel to. At this point, I believe that also one of the organizers will join us. And I will invite Professor Dr. Mozatic also to confirm that he's online at this point.
Thank you. Hello, and I wish you a very warm welcome to all this new normal virtual participants and speakers in behalf of the Crikvenica Health Tourism Cluster.
Thank you much. Thank you very much, Professor Mozatic. Also, if there will be some questions from the organizers or to the organizers, I do encourage you to participate actively in the event and bring in some contact, some fresh news, information, any knowledge or experience that you may find useful to any of us. In the meantime, I have a question, and the question is to all of you. And we have seen plenty of opportunities mentioned. We have seen plenty of data, but I would like to be living in, not in a land of opportunities. I would like to live in a land that has already used the opportunities. So in behalf of the audience, I would like to ask you all, can you give us a piece of advice to majority of our stakeholders and audience, which are business people, especially in Croatia, on what do you think can be opportunities that we can undertake ourselves? So not to ask the state or the public shareholders what the state can do for us, but what we can do for every single of us to adapt to the new normal and to work in the environment and maybe to use all the opportunities that Leila just stated in her presentation in every single way that covers your presentation or profession. So if I may start with the first presenter today, with Professor Đikić. Professor Đikić, I hope you can hear us well.
Yes, I hear well. Thank you.
So can, for the very beginning, we get a piece of advice on what do you think that businesses should take care for or pay the attention most or undertake or own as an idea in the following time and the year that's ahead?
First of all, the terminology new normal is a bit political. I think one really needs to understand the two aspects. One is the business aspects, where people need to have plans, and plan needs to be based on a certain conditions. And conditions at the moment is that we are all affected by pandemic. And pandemic is a serious one. It's a global, and it affects people around the countries, around the globe. So even though in Croatia, if our business people in tourism want to plan something, they cannot plan it locally. They need to really see the situation in the world. So based on this one, I would say that there are two aspects. One is the health component and the pandemic component, which we need to monitor. And the second one is under the light of this pandemic, which is most likely going to affect the entire 2021. We need to be realistic and see what are our expectations, what are changes that we can do to improve the tourism, how to create a tourism that will be quality and not mass. And this is one of the opportunities which I see. If we work on a high quality tourist with the security that they require, with commodity that they need, with the fact that they really need some rest after all of these 2 years of difficulties, of psychological business difficulties, these people will pay for the highest quality tourism. And this is what I feel the chance is. Despite the problems, there is still chance for the high-end tourism.
Thank you. Ms. Krešić-Jurić, a piece of advice from you.
Well, just to capitalize on what Professor Đikić said, actually, I would remember when it all started. We were working on an online small conference. Well, it was not small at the end. It was with 1,000 people listening to it, called Smart Tourism. And the idea was to immediately, already, it was 5th of May. So practically the very beginning, we had few weeks to prepare. We wanted to take out the good examples, what's going on, what people are already having in mind, how to change, how to adapt, how to actually make their living. We were only addressing the private sector. And now I remember that we said at that moment that the health tourism, it's something that it should gonna be the product that should help Croatia flourish and position itself as it should be on the map, at least of Europe, that we were talking at that time. For the moment, we have been having this mass tourism. We are not running out of, we do have fantastic seashore, we do have fantastic coast, we do have good quality of the seawater. The sunshine is there, yes, 300 days per year in some regions. It's all there, but we have to use it in a way to attract those people that would pay extra money. And out of the research I was just looking at before, those coming for health reasons are ready to pay 450 euros per day, even those who are coming only one day. Just imagine the average in Croatia is 98. So we do have the potential. These people are already coming. We just have to structure our marketing efforts and present to these people what they need. And we now know what they need. All these European organizations have been doing research. It all points out that everybody is seeking for health. And it's not going to vanish because of the vaccine. Even when the vaccine will be discovered, people will still be searching for health much more and appreciating health much more than any time in our life, our past.
Thank you. Ms. Udovicic.
Thank you. What to say more than that? But while Leila was speaking, I was taking some notes. Maybe now is the time to tell what I was thinking before. It's the part of your question also. And just for introduction, I want to say that everything has been changed, but also in tourism, we can say everything has been changed. And I think that we, first of all, have to figure that out as soon as possible. And when we accept that, we can move on. But not in a way that we act before, but in a whole new way. For most of the people, safety was and still is the most important condition for traveling. And if there is no safety, people will give up traveling, simple as that. And which leads us to a second point, that we have to define the new motives for traveling, new motives for arriving at a particular destination. And that means that in this health tourism is a great way to do that. Also, I don't know, tourism which is based on outdoor activity, but also gastronomic tourism, but definitely one of the biggest chance is here for health tourism, as I see this. Our answer, why is my answer this health tourism? Because such as people are ready to stay home to preserve their own health, they will also be more motivated to travel for a health reason. So my answer on your question is definitely a special form of tourism that we have to put in a better position.
Emphasize too.
Yeah.
Okay, thank you. Mr. Mozetic, I must say that the very fact that we are here, that we are talking, that we're receiving all the knowledge online, I can consider a considerable success. As a year ago, we had quite a nice event in Crikvenica. You hosted and one of the organizers. And I guess you do have an advice for us as well. As you have an example, Leila has shown plenty of examples. We have listened to some guidelines from Ms. Udovicic and from Professor Đikić. So what would be your advice to all of us, how to head on and how to keep doing successful projects as this one, or in the future maybe even more successful ones?
So definitely, I now agree with all presenters in their thoughts, because our strategy, I'm talking here in the behalf of the Crikvenica Health Tourism Cluster, and I need to show on the beginning who we are. We are an association of 32 companies from the part of health, tourism, science and education. Both private and public institutions, with main goal to emphasize our destination as a destination of health and well-being. In the first step for domestic people, and in other hand, we want to use that as a presentation for the tourists. Our main goals, which are directly connected with the nowadays situation we are facing, it's in 4 fields. One, it's preventive medicine. The second part, it's lifestyle medicine in all meaning of that word. The third part, it's rehabilitation, both physical and mental, which is really important in nowadays time. And the fourth part, it's active aging. Due to realistic demographic situation in all, not just in Croatia, in Europe, but in all world. Our cluster with 32 members has more than 7,000 employees, in which are more than 5,000 medical staff. And we are not just connected in the part of health tourism, but in the same time with the health industry. Professor Đikić is the member of International Scientific Board of our university in Rijeka, and University in Rijeka is one of our biggest partner in our work, because we want to make together health tourism and health industry, because we want to work in the so-called triple helix model: health, tourism, science, and education. Of course, nowadays we are facing with everyday organization of health system here, but if we are looking in the near future, because Professor Đikić told us very precisely that we need to think, if we are talking about a new normal, not political, new normal time, that we need to face to 2022 as a year when we will start in normal way. So we already prepared programs which are based on rehabilitation and preventive segment of everyday life of domestic people and tourists. About the numbers, because they are very important. In 2019, we have on Kvarner more than 90,000 tourists who came here for the medical reason. If we that count with around 400 euros per each patient, we are coming on the numbers of around 40 million euros of income for medical tourist reasons. So 85% of those numbers are from dental tourists, but the part of rehabilitation tourism starting over. So if we are looking in the next few months, we are preparing programs for the tourists who will come here, and in the 4 previous meaning parts. And of course, we want to challenge with informations from scientific part. So if the situation with pandemic will be better during the spring of next year, we can start with the programs very, very fast.
Thank you, Professor Mozetić. I actually had some questions targeted to Professor Đikić, but one of the things that is a bit interesting that you mentioned, and it's also related, of course, to the COVID patients. So, Ms. Krešić, first, I would like to ask you, what do you think, are there any challenges when the branch of health tourism takes on COVID and COVID patients? Is that possible? Would that be possible, maybe post-COVID recovery or COVID itself?
But this is precisely what I was pointing out as one of the opportunities for Croatia, because, as you know, practically 20-25%, I think this year, of all tourists to Croatia are Germans. They are followed by Italians, by Austrians, by people from Central Europe. They are easy, these countries are easy accessible, or better to say Croatia for them is easy accessible by car in only a few hours. Not everyone is coming from north of Germany. Practically most of them are coming from the south. And in only a few hours, they can just come to the paradise, you know. Even from now, today we are in Zagreb. You see how the weather is, and it's not so good for my lungs. It's not so beneficial. But yesterday I was in Split. It's for 22 degrees. The air was pure. I was breathing pure air in the hill, running there, and it's totally different recovery for the body and for the organism. Of course, we are talking about healthy people now, but when you talk about the COVID people, they will need even much more help with this regard, and they will need to go. We need to offer them destinations that are scientifically proven that they can offer them recovery. We have Mali Lošinj, we used to have Baško Polje, but the weather is still there, maybe just not the facility, but the weather and the conditions are there. We have Crikvenica, we have Opatija, we have the whole, practically the part within Istria, these hills, the mountains, they're healing you just for being there. So these are all the parts of Croatia, not to mention Lika and all these mountains part that also have help people heal and give them space. They all need space. They don't want to go to the small apartment or a small hotel, a big hotel with a small room. No, they want space. They need space, and we can offer them.
Thank you. So Professor Đikić, basically in the Kvarner region, and you are almost considered local, as I understand, Professor Mozetić. So can you tell us that, 100 years ago, even longer than that, there have been several hotels founded in Kvarner Bay by the name of Therapia. And we know that there is a history of health tourism that dates since those days. We have heard Ms. Krešić. So can you really confirm that there is a scientific and medical background for people from Central Europe to spend their days, especially after COVID recovery, in Croatia and in Kvarner in specific?
I can briefly say yes, but I would like to comment first, and with big smile on this split 22 degrees. This is something which is attractive, positive. Croatia has beautiful advantages. Geopolitically, it's localized such that people can come out within a few hours by car. Many of the people would do so. And it is correct to say that they need space, they need safety, and they need professional treatment in health sector. And this is where Croatia has been historically known since the time of Austro-Hungarians. Opatija, Kvarner were the place where people were coming, and they were coming at a very high level. And we were known across, at that time, so-called a European landscape. So today we have additional advantage. We have managed to prove that our health professionals, and in particular doctors, but not only doctors, physiotherapists, the nurses, the dentists, I think many of these people have been proven, have now records, have also the licenses which are trusted from America to Europe. Those people are ready. It is most important now to organize them well, to provide them with not only financial support, but also security support, such that the ministries are following them, taking a part of a risk, investing in this, because if we just plan for 1 or 2 years, it's too short. We need to plan from now 10 plus years. And 10 plus years means we need to also start educating people at the faculties while they're studying medicine about health tourism. What is required for that? Which type of attitude, which type of communication we need with these patients? And just one comment on these post-COVID patients. Yes, this will be a significant number of people who will suffer with the post-COVID problems. And it's not only somatic, meaning chronic sequels, chronic disease symptoms. It's also going to be psychological. People will need a certain time of mental peace after these 2 years. It's not easy for anyone, from kids to adults, but the families are affected. And imagine now a family comes out to the place where there is a support, psychological support. We call that help to the families. They will like it. And people are ready to pay even more than 400, when they will get something that is for their health important, for their peace, for their rest, because people work too hard during the year. They want this time. Quality is above anything. And I know it very well. Time and quality of free time is the major money, the major value that we have as professionals today.
So can we say that we should be a bit more focused on the pandemic than all the numbers related to COVID? Like, should we maybe talk more about the raising immunity, healthy lifestyle, despite talking about all the negativity that comes with the COVID? Can we?
I think for the health tourism, I would not go toward the details of a current pandemic. I think this is something that every country needs to deal. People are being protected based on their own systems. But I'm trying to look in the future, even after the 2021 vaccine is going to come, most people will be most likely vaccinated, and the virus will not be able to spread so fast. It might happen that virus disappears by end of 2021. It might happen that virus stays, but it's going to stay on a much lower level than up to now. So we will live in the normal way with this virus, like we live with other respiratory diseases. But what I'm trying to preach is that we need to think what will be a need of the people in this so-called post-COVID, post-acute pandemic COVID crisis. What are the things we learn now, and what do people need for them and for their families in the future? And that's what I was trying to say is a post-COVID help, not only by health professionals, but by environment, by space, by being in this thing where you feel, wow, this is beautiful, but also safe for me, and I am relaxing now. I go back to work next week, but I did my work, my rest completely.
Thank you. So I have perhaps a question for the rest of you. We have been observing the situation with the healthcare challenges at this point in Croatia, especially the public healthcare services answering the pandemic. So what I was looking forward from you, Ms. Krešić, is can you tell us how would you assess the current state of the medical tourism industry here regarding the challenges that we have now that we may face in some brief future, or let's say throughout the year?
Well, thank you for the question. Namely, even before the COVID started, we already had shortages of doctors. And health travel, health tourism was perceived as one tool how to attract those doctors to actually stay in Croatia, because offering them an alternative to work in a private sector or combination private and public, but actually to make them, allow them to earn more their salaries or double salaries somehow. However, now with the situation, of course, it's a bit tricky, but I haven't heard, which is not, I don't know if that happens, but I haven't heard that private sectors, doctors from the private sectors now went back to the hospitals help to COVID. I don't know about that. So I don't notice that something happened with this regard. But namely, the medical tourists in Croatia that are coming strictly for medical reasons are dental tourists. So we are still not, unfortunately, we are still with very low numbers on the classical medical tourists that we would like to think of, and which usually is the first association when you talk to someone, you say medical tourism, you don't think about dental immediately, but it is a situation in Croatia.
Mm-hmm. Okay, so...
Sorry, I'd like to just catch in about the information of the cooperation with public and private sector during the COVID time, basically of health system, because as a director of community health center, I'm directly involved in everyday work. And I have to say that in our region, I think that it's most part of the Croatia too, there is really good cooperation between health professionals in both private and public sector. They all offer their services. We already day by day work from primary healthcare, outpatient healthcare, and hospital care with the whole staff. We have it, and we share that stuff. And day by day, we are working together. So that's really important because, as Professor Đikić mentioned in that presentation, from the individual part, community part, company part, as well as from the government part, we need to work together to solve that pandemic situation as fast as we can.
Thank you, Mr. Mozetic. In line with this, I have a question for Ms. Udovicic. So does the ministry have already plans for the post-COVID times regarding tourism and health tourism?
Definitely, it will affect on our strategy that we are preparing right now. It will be the strategy from 2020 to 2030. And health tourism will definitely be one of the most important point that we have to be focused in the period that is coming with, as I also said before, the outdoor activity, but also gastronomy and enology. I think that these three things will be one of the most important goals to make the good results in tourism for next years.
And I guess that being part of the European Union can provide specific opportunities and benefits just as well. So I guess there are EU-funded projects for development of the health tourism that you are considering in the future.
This is also something which is now in preparation, and our strategy will be the basis also to take some money for EU funds.
Great. So it doesn't sound non-prospective, and I think that regarding all those processes of all stakeholders, we are looking to quite a bright future. However, we are all here in the studio, and whenever somebody sneezes or coughs, or you see them a bit with a drowsy nose, we look at each other. It's very suspicious. I have a kid, 3 years of age. He goes to kindergarten, and every single week or every second week, we're all a bit stressed about: is it just a cold? Is it a flu? Or is it a COVID? So for Professor Đikić, can you please help us? Because we're dealing here with people on an everyday basis. We're in the service industry. We have to meet people. We have to encourage our staff and professionals to interact. So we would like to a moment to perhaps emphasize again, how can we differ COVID from the flu and other similar diseases? Do we know how many people are ill from the flu and how many from the COVID in general?
All right. So it seems very simple a question, and one would say, oh, this is the number, and then you can distinguish, but the reality is more complicated. First of all, we do not have yet a total number of infected people by COVID. With all the tries and with all the capacities we have, we are below the limit. And for the influenza and cold, which will be coming soon, or they're already here, we are actually quite not prepared. The number of vaccines we were supposed to order for the influenza is significantly lower than the current wish and need of the general population. And what I was trying to put in several public articles, and my wish as a scientist is to really contribute to education of a general public. When I was writing, I was saying summer is the time when we need to prepare us for the fall and the winter. And prepare means we need to test, we need to introduce more technologies. And one of the technologies which I was praising very much was to introduce the very rapid test in which the doctor of general practice has a test in his lab, in his office, and can test immediately just by putting a small spot from the breast, put a spot and test immediately. Is this positive for influenza or is it positive for COVID? And this can be done because there are specific antigenic tests. And these antigenic tests are now being used even in Croatia as against COVID. But these tests exist in the one kit for both COVID and influenza. And this would be a great help, not only for the medical doctor, general practitioner, this would be a great help for the entire system, because suddenly you would not have any more, oh, I don't know whether you are infected or not. You would know this is influenza, this is COVID, treatment A, treatment B, classification, and the proper measures. And I think this is something where we should be, and I think we still should introduce those because they do exist, this type of test, and I think it is a little financial investment for enormous economical gain. Because once you prevent overloading of the health system, of our hospitals, you are bringing tons of money as a saved. Imagine 1 day in hospital versus 1 hour small kit test in the physician's office. It's plus 10, plus 50 sometimes cost.
Thank you very much. And in the meantime, I see that our audience has been pretty much active and do follow the panel discussion. So we have received a couple of questions from the audience. So we have for Ms. Krešić-Jurić a question. The idea of rehabilitation after COVID-19 as a part of health tourism is excellent, but do we in Croatia have the capacity in medical staff, doctors, physiotherapists, psychologists, who would provide this kind of service? Do we have any data available on it? So it's more like a medical question regarding perhaps somebody from the Ministry of Health, but maybe in your database you have the answers for the question as well.
Well, I don't have a straight forward answer, but I do have an answer. So when you launch any product, there is always a market. And it's great if we have more demand than what we can offer, actually. The worst thing would be that we offer something, we launch post-recovery packages, and nobody wants to come. So, like market regulates a lot of things in life, it should regulate here that more quality product we offer, and we have been talking about quality before, and specifically Professor Đikić made a point on that, then we will be able to charge more. But of course, it does not mean limited more. It means something which would be fair amount of money in exchange for the product. For the moment, we do have excellent facilities in Croatia who are providing these products. Some of them are in so-called regional level ownership. Some others are private. And those private that I'm very well aware of how they are working, they are doing excellent job. And they're already proven to take on very serious cases, serious rehabilitation patients, just not to go further off Termeselce. And there are several others that in Kvarner and in Croatia. But can I just capitalize on something else with regard? Why not offering through our power in European Union now? And I can say I'm proud to say that Croatia now, I, as a Croatian citizen, feel that my country has some sort of power as a country in European Union, unlike it was 10 years ago or 2013 when we just joined the European Union. Why not make a contract with the German Krankenkasse for those specific facilities and infrastructure that can offer proof of scientific proof that post-recovery the recovery for post-COVID would be possible in Croatia, and put these facilities on the list of the German Krankenkasse, which means that agencies, I was actually asked yesterday, for Croatian agencies based in Germany who is sending patients to other countries, but not to Croatia, because it will not get refunded if being sent to some Croatian health resort. So this is also a land of opportunity for us. Of course, it's not going to happen because small company or small resort approach German government, but I think that to help with our government, we can arrive to this list and then open these corridors. And if there is more demand, the price will practically decide at the end.
Okay, so but do you think that perhaps the Croatian associations can lobby in a way, in a horizontal way, with the foreign organizations as well? And
I think Croatian government can lobby that. That's how it goes.
So Ministry of Health, basically. Ministry
of Health. I'm sure that Ministry of Tourism was always super helpful with the regard of health tourism. For the last 5-6 years, it was a really great communication, which I witnessed. And I think it's something, it's too important to be left only to the small private stakeholders. I think the country should be involved, because at the end, it's going to be the benefit for our country in general.
Thank you very much. Thank you very much, Ms. Krešić-Jurić. Do we have any more questions from the audience? We have one more. Let's see what was of the utmost interest to the people that have been able to observe and follow the conference from their offices or homes. Hopefully homes, because it's a working day. So I hope that everybody, if it is working, it's working from the home office, if not from the office. So can you share your thoughts with us regarding the matter? What exactly Croatia or similar small countries need to achieve the success in health tourism, especially in the post-COVID phase?
So first of all, we have to forget the mass tourism. This is extremely shown in this 2020. And we have to be focused, as I said before, to the particular form of tourism, such as this one. And also through the European funds, we have to be able so much stronger to get some money to invest in our hospital, but also, as Leila said just right now, to connect with other countries on the national level, speaking through governments, to connect, to be able to receive such as post-COVID patients to come to Croatia, because I know we have this kind of destination, also said before, such as Mali Lošinj, that are prepared to receive this kind of patients for long-term rehabilitation.
Thank you very much. So basically, we should all work together with public stakeholders, and they should approach the other governments and institutions within the European Union. So it's a large market, and I think that we are already in the focus regarding the season as it was. And you know, everybody usually comes to conferences to learn something new. Mm-hmm. So what interests me the most, because in a way I'm in a tourism business, and although we are looking forward into having a year-round tourism product, I mean, face it, 80% or approximately of tourism traffic happens in the season. We had a season this summer, and to be honest, we were not sure what kind of season we would have had. And then I think that we were all pretty much well surprised with the success. We could be happier, we could have been even more successful, but nevertheless, I think that Croatia has fared well better than maybe other competitive destinations in Europe, not to mention in the world. And I have for the conclusion a question for Professor Đikić. Can you tell us, please, what the next summer season in Croatia will look like? You are from the Kvarner, you are working in Germany, which is our most popular emittive market, so, and you're a scientist, so if you don't know, nobody knows.
Right, so I think from scientific side, I think we will be under control of this virus in a much better scale than now. There are many signs for that, both from the vaccines, drugs, testings, and the education of the public. We know how to behave today. We know what are the measures that prevent and protect us. But I think what I would like to say that I would spend another 4 to 5 weeks next summer in Croatia, bringing my colleagues and friends from Munich, Frankfurt, Germany, across Europe. I think we need to work together to promote Croatia as a safe, very healthy, and very beautiful tourist destinations. And I'll just refer to the comment that we just heard, really very nice. It is about organization of the country. It's not about the private stakeholders. It's not by connecting the Kvarner team. These people are fantastic. We in Croatia, we know that our nurses, our physiotherapists, dentists, and physicians highly appreciate it. In Germany today, you come out with the license from Croatia, you're going to get a job. So the people trust the quality of our professionals. However, they cannot lobby alone. If the government, and this I don't mean only Ministry of Tourism, Ministry of Tourism needs to be only an opener of the table discussion. The Ministry of Health, Ministry of Science, Ministry of Finances and of Economics, all of this will need to work together to create a compact program by which government, meaning the Prime Minister, will come out and negotiate with its own partners in the EU, provide the quality, guaranteed quality to their systems, and then Krankenhaus insurances in Germany, hospitals, they will undersign that, and they are going to work with us as a country. And then your quality, your talents in Kvarner or in Dubrovnik, they'll come up and they will just be on the market, and they will have many, many more opportunities to get a health tourism on maybe multiple times higher than it's today. And for that, I'm appealing really for the government as a whole to make the programs, make the plans. It is not politics of 1 year or 2 years. It really will determine 10 plus years how Croatian health tourism is going to be successful or less successful. And I believe on this, large proportion or large percentage of the economical gain that tourism brings to Croatia might come from the health tourism in a decade from now.
Thank you, Professor Đikić. However, you know, for us in the tourism and service industry, a client is the king. and our audience is our clients, and we got a last-minute question, another one for you from our audience. So is there one for all countries parameter for green or red country according to the current situation? From Ms. Irena Rapaport. So is there...
Correct. There is no one parameter. Every country should be first honest to its citizens. Every country should test fairly. Every country should not manipulate the data. Once you have the correct data, this is the only parameter. Based on a correct and honest data, scientists, epidemiologists, public health specialists will tell you this is a danger of stage A, stage B, stage C. And this is what we need to accept. There is no red, green. There is a stages by which we are securing our health based on a correct data. Unfortunately, many countries around the globe, like we heard even from the most technology developed country, follows the rule, less testing, less positive, better for us, because we don't need to respond to it, even though we are aware that virus spreads around us. And it's all tolerable until the health system is not overloaded. And this is not an overloadness of what we have seen in New York when people were truly on the street. Overloadness also means that my mother or your families cannot go to hospital to get a normal diagnosis for their own chronic diseases. That is already a damage to our health. So it is not only how many people have died in the last month. It means that when our physicians come out and state, it is an alarm, we cannot provide anymore a proper health system, to proper health care to our citizens, we need to react. And that we means the government. And government has zero chance in democratic society to ignore that, to manipulate with the data, to send scientists to the TVs to wash out some of the bizarre statistic, 1 out of 10. I think that is a true democracy. And this is what I'm appealing in Croatia. We as citizens, our voice needs to be heard. We need to call upon elected public servants. We need to call upon them to be truthful to us and to really protect what is the most precious, and that's our health and our life. Nothing else counts. We need to be aware that economy is important, but not more than a life of an individual, because economy will recover in 2022, 2023, but 800 people, 900 people who died now, they are lost forever. And this is something where me as a humanist and as a scientist can only appeal to the government to follow the data and be correct and honest and not manipulate by testing.
Thank you very, very much, Professor Đikić, with your honest and direct thoughts that you shared with us, advices that all of the panelists have provided. And I'm very thankful for all the information, that we have received through the first block of the first day of our Crikvenica International Health Tourism Conference.